The views, information, or opinions expressed during AAOA broadcast series are solely those of the individuals involved and do not necessarily represent those of the American Academy of Allergic Allergy, its employees, or members. The AAOA is not responsible and does not verify for accuracy any of the information contained in and assumes no liability for any activities in connection with these broadcasts. The primary purpose of this broadcast series is to educate and inform and does not constitute medical or other professional advice or services. Advertising which is incorporated into, placed in associate with, or targeted toward the content of this product without express approval and acknowledgement of the AAOA is forbidden. These broadcasts are available for private, non-commercial use only and may not be edited or modified from their original form or reproduced for distribution.
Welcome to anyone who is joining us for this Zoomcast. The purpose of these offerings are essentially to bring you up-to-date, relevant information that can impact your practice right now. And of course, anything related to COVID, which is the topic of this Zoomcast, is rapidly evolving as it has been for quite a while. But our distinguished panelists today will enlighten us with respect to some of the recent improvements and updates in terms of the vaccines, what to expect, and what this means for us and our practices. So I'm just going to kind of go around the folks that I see in my Zoom window and just have you guys all give a brief introduction. And so let's start with Dr. Rob Stackler.
Hi there. I am a private practitioner doing otolaryngology as well as otolaryngologic allergy in Detroit. I have a focus on voice, speech, and swallowing. I have been involved in the AAOA for quite some time, and I'm happy to be here. I have no conflict of interest to report.
Great. And then Dr. Michelle Liu.
Hello, I am Michelle Liu, as you said. I practice general otolaryngology in Bethesda, Maryland. I've been involved with the AAOA for at least a decade. And I have a special interest and focus in quality and patient safety as well. So I'm happy to join you. I have nothing to disclose.
Great. And then last but not least, Dr. Patel.
Yes, hi, I'm Nalin Patel. I'm currently in private practice and also a collaborative assistant professor at the University of South Florida. My focus in my practice is primarily pediatric otolaryngology with otolaryngologic allergy as my sub-practice in kids, and I have no conflicts to disclose.
Great, and I always forget to introduce myself. So I'm Jennifer Villalock. I'm at the University of Kansas. I also have no conflicts of interest to disclose. And we really wanted to focus this discussion today on the COVID vaccine, specifically the two that are currently available that are mRNA-based. And where we wanted to start the discussion is where a lot of our conversations with our patients may start these days as well. And so what is the most effective way that you all have found to really explain to patients as well as others in your life how the COVID vaccine works? And Dr. Stachler, I think we'll go to you first.
I basically tell people that the vaccine will teach our immune system to recognize the virus and neutralize it and express the concern of how important it is for people to get vaccinated as soon as possible for the purposes of herd immunity. So I'm all for the vaccine. I realize that there will be some unpleasant side effects in some individuals, but the importance is that we get the sleeve rolled up and we get it done, and we do it for our friends, our neighbors, and for everybody. So.
And Dr. Patel, are there any common concerns that you've been hearing from patients or others in your life, and how do you address those?
The common concerns are what are the rates and risks of having a severe allergic reaction with this vaccine. And the published data shows that it's at a low rate, about 1.3 in 1 million, which is not common. And it is something that can be managed at the time of the actual vaccination. And then there are some more unusual complaints that people have brought up, which I was asked a question, is there a chance that my daughter would become infertile with the vaccine? And there is no evidence that an mRNA or any type of vaccine can have that type of an effect. It doesn't change our DNA. So there is quite a bit of misinformation that may be out there as to what these vaccines can do. In general, both the mRNA vaccines are very safe. They do cause an inflammatory response as part of the intended effect. So you're going to get, and you expect to get some type of an inflammatory reaction, whether it's pain, whether it's soreness, whether it's fever, whether it's fatigue or body ache. That's just part of your immune system doing its work. And if you don't have a response, I would question as to how effective the antibodies that you're going to produce after you get vaccinated will actually work to prevent the infection in the future.
And Dr. Liu, same theme of questions to you. You know, Dr. Stachler mentioned the importance of everybody rolling up the sleeves so that we can get to some effective herd immunity rates, but certainly, I think there's vaccine hesitancy in many groups, including those that are highly educated. I don't think it's an issue of education necessarily. So I'd love to hear some of your comments and insights related to that.
Yes, that's definitely a point I wanted to make. I always highlight, and I've had colleagues mostly, as much as patients, approaching me, giving me personal phone calls, to ask, especially before I had my first dose and posted it on social media, you know, what would you do? How do you feel about this? Do you trust this vaccine? And early research has shown that only 14% of African Americans trust that this vaccine is safe. 34% of Latino Americans trust this vaccine. And so there is data showing that there's distrust, and there are many historical reasons for that. But I think what I highlight is addressing one concern, which is this a live vaccine? And you know, messenger RNA, just explaining that it's not live. I even have a daughter who is a lung transplant recipient. So that was one of my first questions. And I try to be as transparent as I can be about my personal decision making. So I think what I would encourage others to do is, if you had any doubt, it's okay to just be transparent that even you were hesitant yourself. You were afraid of reactions, and yet you were willing to take the risk for the sake of our community, our country, you know, all of the things that we've had to endure because of this pandemic is worth the risk that we've all personally taken for those of us who've had the vaccine. So that's how I start out my discussion, is just bringing it home to address that distrust. But, you know, I'd be happy to go into a little bit of that history if you want me to later.
Yeah, no, I think that was excellent. And, you know, we were talking a little bit offline, or I guess online in a different fashion earlier, and, you know, about how you can be one of the most highly educated people and, you know, live in this realm like a lot of us do. But I certainly experienced an increased heart rate and some sweaty hands right before that needle went in, you know, in a way that I don't typically for the flu vaccine or for my tetanus booster, you know, so these things are real. And kind of like just telling your kid not to be afraid of the dark because there's nothing to be afraid of. Well, if they're afraid, they're afraid. And so, you know, we have to meet and address that fear and where it comes from the best that we can. In terms of the actual safety concerns, and Dr. Patel, you were commenting on this, you know, there were some early reports of some allergic reactions, and then of course there were some sensationalized kind of news snippets about people having this type of reaction. Can you repeat again for us kind of what the numbers are that you're currently quoting to your patients, or how you're allaying some of those fears?
Based on the current published literature from the CDC, the current rate of severe anaphylactic allergic reactions is at a rate of 1.31% for every 1 million injection. And so that's a low rate. And typically the primary ingredient that they've identified as the potential source is polyethylene glycol, which is used in lots and lots of normal household products and that are used on our faces, used in other things in our daily lives. And so it's not as if that's a rare ingredient, but certainly people can be allergic to anything out there, whether it's pollen, whether it's dust, whether it's mold, you know, whether it's a food product, whether it's palm oil or coconut oil. So you can't have any type of a vaccine that's going to be completely risk-free, but it's a very low rate. And so the concern for anaphylaxis should not be the reason why you don't get the vaccine.
Yeah, and then as you all have mentioned before, we do want to make sure that we're not glossing over some of the very real anticipated, effects of just kind of not feeling super great after you receive those doses. Have you all heard anything in particular about the incidence of delayed large local reactions and what folks should make of that?
I have not.
I've not either in the long term. Most of the people that had reactions had it within the first 15 minutes, and that's why they recommend hanging out for 15 minutes. And in my case, I just hung out in the amphitheater and made conversation with people that were just sitting there looking around, waiting to talk to me. So, I think that if most of people feel like they got punched in the arm, and I've recommended using ice, at least for my employees that got it and had a little bit of pain or a little bit of difficulty. It was mostly just muscle pain.
Same here. I haven't heard of any reports of delayed local reactions. I have heard some incidences of nausea and lightheadedness. I don't know if that's vasovagal or, that anticipation of getting the COVID vaccine that some people have reacted to. But I've also heard with the first dose of people being bedridden for anywhere up to 3 days with fevers, and that incidence increases certainly with the second dose, and a lot of people are doing NSAIDs and various home remedies to address those symptoms, which tend to be temporary.
And I did see a little bit making the rounds on social media about these more delayed reactions. And so I think it's just important to know that sometimes the symptoms that you get can be delayed. I was lucky enough myself to get a delayed local reaction. So I got basically a huge welt on my arm about 3 to 4 days after. But the guidance out of Johns Hopkins from that group is essentially saying that, it's a very low rate, like 0.2%. Of folks, and it's not a contraindication to the second dose. In my case, it just resolved with antihistamines, but it looked much more impressive than it actually felt. And so, as we think about safety concerns, what to expect, et cetera, are there any special considerations that you have for your patients, especially those that are receiving other immune modulators, such as effectively that is what we are doing with SCIT and SLIT?
In my SLIT patients, as well as my subcutaneous immunotherapy patients, I try and space it out as far apart in terms of when they get the vaccine. And then I would have them hold SLIT for the rest of that week and just start again the following week, at least 3 to 5 days apart.
Yes, in my population, actually, a lot of the patients are just going forward because maybe because of our discussions, I really make sure I have as many of these discussions with and I have a special population as well. They're just very eager to get the vaccine. And so most of them have not been worried about that allergic reaction. I haven't heard any incidents reported. I've had some asthmatics actually concerned about getting the vaccine, but they haven't had any problems.
Great. And then same question, but for our patients that are receiving biologic injections or infusions.
I have not heard problems with people getting biologics or having problems in the first place. I think we have to be concerned about those that are immunocompromised from the get-go. And if we suspect that somebody's immunocompromised, that we have to be a little more cautious or be cognizant of that before we proceed. But in general, I think that if you have a fairly immunocompetent person and you're giving them biologics and they're doing well, that I think that they can go on and get the vaccine without. There has been nothing that I've seen in the literature that have been suggestive that we have to modify our biologic dose.
I'll add that actually the transplant community and also those who are treating cancer patients strongly advocate for their patients to get the vaccine, just like they advocate for them to get the flu vaccine. As long as it's not a live vaccine, they feel it's better for them to be protected and take that minimal risk.
And both the vaccines that are currently out are not live vaccines, and so there is not an increased risk of further immune suppression. The main thing I do in my patients who are on the biologics is, again, to just separate it out, not do it the same week.
Right. And then sometimes these conversations, there's often a lot going on behind the scenes, and in someone's mind as you're having these conversations. And one conversation might not be enough. Do you all have any recommendations as to where patients should look for additional information? Because as you all have kind of touched on, there's a variety of information that's available, some of it more correct than others. And so is there a source other than, just referring them to cdc.gov or those types of websites that you have had success with or that you find are particularly user-friendly?
I actually refer them to the AAOA site with the COVID-19 vaccine FAQs. I think it's actually very well written, very easy to follow.
I similarly do that as well. And I find that's very helpful. And I tell them to make sure they go to the patient section and not the doctor section. And I tell people not to go on sites that are not approved. So the Hopkins site is reasonable, CDC sites are reasonable, other ones that are inciting fear and panic. I try to tell them, just don't believe everything you read.
Yes, and I wholeheartedly agree with that. I think AAOA, especially because we have this population we're treating for allergy, is great with the FAQs, specifically answering questions that are most commonly asked. And the CDC website, of course, is one of the most reliable sources because that's what they hear about in the news, and that's what a lot of people trust. Where some of the distrust comes from, I think, is just a history of experimentation in certain populations. And I think it's important for us to be educated on that as well. So I do encourage providers to read about the Tuskegee experiment, to understand where that distrust comes from and understand that it wasn't that long ago. So there are people who actually lived during those times when it was revealed that there was a cure for syphilis, and African-American men were not treated for a period of 40 years. So that having that information and being able to speak to it and say that there's this awareness and there's been a reaction and there are a lot of protections against that happening again is very important to get these special populations to regain trust.
And then after, your practices and certainly frontline healthcare folks, et cetera, find themselves in the highest priority to be vaccinated, I think a common question that comes up is, do you anticipate changing any of the PPE or other guidelines that are used in the office? I'm shaking my head with you, Dr. Patel. Like I think back to the pre-COVID times of, how laissez-faire a lot of us, or at least I was, with some of these precautions. So what are your thoughts about the post-COVID world and what'll stay the same in the realm of COVID with now an effective vaccine versus in what ways are we never going back?
Well, I would say that the current vaccines were identified in terms of effectiveness with masks and social distancing. So we don't know how effective they are if we lose all of that, if we stop hand washing, stop wearing masks, and stop distancing. Does that 90, 95, 94.5% drop to 92 or does it drop to 50? We don't know because that hasn't been studied at this stage. And so until the pandemic truly ends, we can't lose all of these special precautions in the office as well as in our personal lives. You have to maintain all of those things as we individually have the responsibility. If everyone wears a mask, socially distance, and we did it all the way back in March, we wouldn't have had a pandemic.
I think this is a great question because I also was kind of, comfortable before COVID. And now, I feel naked not wearing iPro, not having iPro in the room with the patient makes me uncomfortable. And it's interesting to see how patients get a little bit hesitant when they have to lower their mask because they want to protect us. That's a very, very interesting and strange dynamic, but I don't see that going away in the near future. And I think, unfortunately, we're going to be masked with our patients for months and months to come. And hopefully we'll be able to relax a little bit, but I think that's not going to change because of the vaccine right now.
I would have to agree with you. I mean, I can, you step aside to pick up a tongue blade and the mask is back up over the face. And you're like, okay, I need to look in here. I've got to look in your throat. I'm sorry. Just give me a minute. I've got my mask on. I promise I'll put yours back as soon as I can. And then you try to get around them and you try to palpate their neck and the parotid glands and the submandibular glands, and you're jostling the mask all around. And so I don't see that ending, and I don't really see the light at the end of the tunnel. Even though we're all getting vaccinated, everything is slow to happen. We're not getting the quickness and the speed with which we thought we would originally inject our patients with, and our friends, family, et cetera. I think that the 100 million over in the first 100 days is a good goal, but it's going to be hard to attain that. And I really don't see the end of this anytime soon. I'm excited when it comes, but I'm not going to change my PPE, and I continue to be very careful with mine in the office.
Absolutely. And so in just a moment, I'm going to ask if anyone has any other concluding thoughts, but I did want to reinforce one of the more recent themes, which was if you're looking for more information, certainly the AAOA website is a great place. A number of guidelines, et cetera, have been reviewed, and there's a nice frequently asked questions as well as some other resources specific for a lot of these issues that we've talked about today. And so with that, I'll turn it back over to my panelists here. And if you have a closing thought, that's great, but it's kind of like residency interviews, no pressure. You don't have to have a closing thought or question.
I think it's great that we all are practicing in different parts of the country, and there's still areas, especially early in 2021, where there are hospitals that are not doing elective surgery because they're overwhelmed with COVID patients. And I'm not working in a hospital like that, but I continuously remind myself, remind my patients, remind my colleagues that could be around the corner any day or any week. And so we really need to be vigilant and not too lax just because the vaccine is here, because we still have a lot of work to do. And even in our personal lives, I know a lot of the infection rate in our hospitals is due to quarantine fatigue and what's happening outside of the clinical areas. So we ourselves need to be vigilant outside of our practices when we're with our family and friends. And that's the hard part. I think that's really the hardest part, is being on guard when we're supposed to be off guard or off duty. And then just remembering to be sensitive when people are hesitant and not to give up on them. I've walked colleagues up to the vaccine site, just because they needed that support. And I think you might be saving a family.
I would say that everyone still needs to continue to wear their masks and continue to socially distance until enough people have been vaccinated for us to achieve herd immunity and the pandemic can end.
I think that we all have to be supportive of each other. In Michigan, we have done a lot to flatten the curve, and we had a big problem initially in March, and we started creeping back up, but unfortunately, that was occurring, and now our numbers are going down because we basically shut everything back down as much as we could. And so even though it's hurt our Michigan economy to prolong the stay-at-home orders and the restaurant openings, I think it's helped us not overwhelm our hospital systems, and we're still doing elective cases. And so I think that we need to be supportive as much as we can of our colleagues, our friends, and just keep on getting beyond this and working hard to be safe in the future.
I think those are all great and wise words, certainly for a path forward. And, to echo what Dr. Liu was saying, I don't think that we ever fight fear with shame. And so, a better way is always kindness and compassion for ourselves, our colleagues, and our patients. And so thank you guys for your time tonight. I know that time is ever valuable. And so we really appreciate your time and contribution.
Thank you.
Thank you.